Hi, today I'm just going to go through a few of the tools that we use for a pelvic exam and pap smear and talk a little bit about what's going on during that process. I'm going to put on my gloves because I would use gloves for handling everything and especially for touching the patient, and I try to make sure that things that I touch with the gloves, so I'm not going to grab handles and then touch the patient, for example. And I have an assistant with me. My assistant will hold this up so that I can grab the speculum. Speculum is a word that is used for a number of different instruments, including, when they look in your ears and you have that little sort of tube. Basically, it gives you a chance to look in a hole. So this is the speculum I most often use. I used to like the metal ones a lot, but this one has a light I can attach at the bottom. Here is the light that we can attach to the speculum like this. And that way, I don't have to worry about the big light, and you can actually see in that way with the light coming right out the little end of the plastic part there. Okay, so I'm going to disconnect this. So once we have the speculum inside, it's opened a little bit to be able to see the cervix. You can see this one's relatively small, so we try not to stretch, try not to make things uncomfortable. I'm going to put that back in here for the moment. And then while the speculum's in place, using little swabs and tools to collect the various specimens. So first of all, if we're going to do chlamydia gonorrhea testing, we can do it in the same specimen as with a pap smear, or we can do it separately with a little swab. So these are the tools that we use for doing a pap smear. I generally use this combination of two instruments. So these are the two instruments I use most of the time. This little plastic device, looks like a little paddle, is just to rub on the surface of the cervix. And that's to extract and to scrape off some of the cells that are coming off the surface of the cervix. Then use this little brush that looks kind of like a mascara brush, and that's inserted just in the opening and rotated to pick up more of the cells at what's called the transformation zone, which is where most of the cervical cancers arise. So once I've collected those specimens one at a time, I have an assistant holding this for me, and they actually get dunked in the solution in this little bottle and swished around, and the cells come off the instruments and then they're discarded in the trash. Some people like to use just a single instrument instead of those two, and this is sort of like a soft plastic little brush, and you can put that right at the opening of the cervix and twirl it around, also to pick up cells, then dunk it in the solution and swish it around and have the cells go off into the solution. Again, they can test the pap smear, they can test for human papillomavirus, and they can test for chlamydia and gonorrhea, all in that one specimen. Alternatively, sometimes we'll use a separate little Q-tip to collect a chlamydia and gonorrhea sample. Or maybe if people have symptoms of vaginitis, like itching, then I'll use a Q-tip, just a plain sterile Q-tip, swab it in the vagina, pick up whatever secretions or discharge I can find, and then I put it onto a slide, a glass slide, take it to a microscope, and look for certain signs of vaginitis. So that's what happens when we're collecting specimens during a pelvic exam. This is the little mascara brush, as I call it. This is the little scraping paddle to rub on the cervix. This is a brush that we can use instead of those other two combined. This is just a swab with a long handle on it. And here is what the glass microscope slide looks like. So we'll just take the discharge and make little puddles on the slide. Okay? So here's a picture of what the pelvic anatomy, including the female reproductive system, that we can use to show people what we're doing. This is the vagina this way. This is as if somebody sliced lengthwise through a body. And basically we take these little instruments up through the speculum and then just rub on the cervix there. Just kind of rub around. It's sort of a circular donut looking structure when you look at it from up the vagina that way. So that's basically where we go to get these swabs and specimens. One last recommendation, a really good source of information for patients is the American College of Obstetricians and Gynecologists. So if you go to www.acog.org, look under publications and clinical information, look under patient education and look under patient frequently asked questions. It'll talk to you, it gives a huge list of resources for you, and one of them is about abnormal cervical screening test results. That document actually also explains the screening recommendations. So for example, from ages 20 to 30, it's pap smears every 3 years as long as everything's normal. Starting at age 30, it's pap smears plus human papillomavirus HPV testing. And then if everything's normal, it's every 5 years. So those recommendations, the details are on that website, www.acog.org. Thanks.